Welcome everybody. I'd be grateful for the speakers to turn on their screens. Thank you very much. Welcome to the third of our webinars prior to the G20 in South Africa coming at the end of this year. We've this month we're covering the issue of development of frontline NGOs, and I'm very pleased to welcome three very experienced human trafficking experts. Tatiana Kotlyarenko, who is currently in Israel. So if unfortunately anything happens, then she may have to leave, but hopefully that will be fine. Tatiana is international expert on gender-based violence and human trafficking. For 7 years, she was the advisor on anti-trafficking issues at the Organization for Security and Cooperation in Europe, Office for Democratic Institutions and Human Rights. She worked on the second edition of the National Referral Mechanisms Joining Efforts to Protect the Rights of Trafficked Persons report, as well as providing technical support and capacity building for OSCE participating states. Tatiana conducted rapid assessment missions and provided recommendations to countries on how to prevent and address trafficking of Ukrainian women and children. She's been the recipient of the Last Girl Awards in 2022. I'm also joined by Dr. Kelsey Morgan, who is the co-founder and CEO of Everfree, a global non-profit dedicated to ending abuse and exploitation through survivor-led data-driven solutions. Over 15 years ago, she began her journey providing aftercare to survivors in East Africa, which led her to establish Everfree in 2015. While pursuing her PhD, Kelsey co-created the Freedom Life Map, an innovative tool that empowers survivors to define their own path to freedom and care providers to measure the effectiveness of their interventions. And finally, Father Jeffrey Behe has been a priest for 45 years and has a doctorate in pastoral counseling. He has been involved in various ministries, missions, diaconate, and priesthood retreats, continuing education, and prison ministry. His ministry is Closer Walk Catholic Communications, and he founded Metanoia Manor, an organization dealing with young trafficked girls, which opened in 2018. He is a participant and presenter at the Pontifical Academy of Social Sciences in the Vatican and a collaborator with the Order of Malta in the establishment of safe shelters for trafficked victims. He had spent several summers with Mother Teresa in Calcutta. So welcome all three of you. Thank you very much for joining me. This is going to be a conversation. So hopefully we'll be able to talk amongst each other, and I'm going to moderate and add my piece as we go along. So the first question I wanted to ask you, and I'll put this to Kelsey, is we recognize that the workers in NGOs, yourself, the other two panelists, many others, are working hard, long hours. This is exhausting work. At the same time, when people talk about the number of vulnerable people, perhaps in hundreds of millions, victims in 50 million from ILO numbers, when we look at the work of NGOs, it's a struggle even to get funding and resources to actually do the work for maybe the hundreds and thousands that NGOs are trying to care for. How when you're organizing an NGO, do you start to think about what is going to be your impact and work in relation to relation to victims and vulnerable, when also faced with what seems like a very large possible group to help? How strategically do you start to think, where can I help, but knowing where help is also needed?
Yeah, Duncan, it's a challenge. We often talk at Everfree about the fact that many program staff are overwhelmed by the volume and the complexity of cases. And we know, sadly, that of the cases direct service providers are working on, it's less than 1% of the victims who are actually out there. So very few survivors ever access services. And of those who do, they're coming into programs and systems that are under-resourced, overwhelmed, and often asking these program staff and caseworkers to collect data and to think about measurement and evaluation on top of their day-to-day life, on top of meeting those urgent needs, planning for the future. it can feel like a burdensome task. And so the first thing we need to pull back as direct service providers and ask ourselves, which can take time, you have to really prioritize the space and time to do this, but it's asking what is the outcome that we're working towards, right? And if we're having that conversation without those who have lived experience, we're already starting off in the wrong way. So we need to be working with those with lived experience, asking what are the outcomes that you're looking for? What is lifelong well-being? What does lifelong freedom look like? And from there, we need to develop systems that actually are working towards that and looking at those outcomes. So we need to design our systems not for what funders want, not to fill out a report for data to sit in a system that's never used, but we need to design our systems that are low burden, integrated into service delivery, and collecting data on what are those outcomes we're working towards, not how many hours of counseling did someone receive. That doesn't tell us anything. And if we're asking our caseworkers to be collecting all this data that doesn't tell us anything, they're going to get burnt out. They're not going to want to collect data. But if we can show our frontline responders, our program staff through data that the data they're collecting can inform their work, can help improve their work, can help them make their work more effective and efficient, we're going to see more buy-in from those frontline workers.
No, thank you, Kelsey. Tatiana, when you're advising NGOs, how have you looked at that problem of thinking about what can be done versus what needs to be done?
Well, it depends on the NGOs. That you have larger NGOs and you have smaller NGOs that actually do a variety of different pieces of the work. And this is an important message that Kelsey put out there, is ethical survivor leader engagement, meaning that NGOs actually also need to listen to the survivors themselves who have gone through the system to understand what is actually needed. Two, it's about tailoring the responses to the individual needs of survivors versus a one size fit approach, because that also wastes resources. If a survivor leader, for example, or a survivor or victim does not need accommodation, forcing them into a particular accommodation is also a waste of resources. So it's about creating frameworks and systems that actually are appropriate in response, which use resources wisely. For example, men who are victims of labor trafficking oftentimes will not need the same kind of responses and approaches as children who are victims of sex trafficking, for example. And the other part is where's the NGO based? For example, in some countries, there are national systems that actually work better. In other countries, they're non-existent, where the NGO actually plays the role of provider of every single service, protection, accommodation, etc., to the victim. So it's about assessing the particular set of needs, the population you're working with, and making it as effective as possible by consulting with those that have received services on what is needed and what works in that particular environment. It's also about taking into account specific cultural, religious, etc. needs of a particular victim or survivor to make sure that the services that are provided are in accord and actually beneficial for that particular person.
To that, and just go back, but and how, with all that in mind, how do we balance between what we can do and what and the size of and the magnitude of the task to actually be done? As Kelsey said, where frontline NGOs in the end may only really reach 1% of those that are actually in need. So how would we then take what we're thinking about strategically and then scale that, or is that just impossible?
I don't think it's impossible. What we need actually is a real commitment by governments, and this is where civil society also needs to ensure that governments do not step back and say, well, you're taking care of it and that's good enough, where there needs to be a partnership, a multidisciplinary partnership between government, and civil society, and as well as private business as well, to actually create the right resources in place to assist as many victims as possible. We are helping way less than 1% of the victims globally, because if you look at the current statistics, less than 1% of victims are being identified. Significantly less even have access to services, and significantly less have access to the whole spectrum of services, from the point of identification to assistance and support, criminal justice and redress, and then social inclusion. So if you're talking about that whole spectrum, very few actually get it. And this is where that partnership is necessary and we need, and this is why we are here for the G20 piece of it, to get governments on board to do their part.
No,
And
thank you.
can I
Sorry,
jump in
Kelsey,
as
go
well,
ahead. Yeah, you
Duncan?
can.
Yeah. I
Absolutely.
feel like Tatiana and we need to talk, because I agree with everything that you're saying. And it's the reason, exactly your question, Duncan, is the reason why we developed the Freedom Life Map tool. Because often what we heard from our team and partners around the world is it can be very time consuming to understand, without tools and systems, what are the individualized needs of each person coming into our programs. And then are we connecting them with those services? And then are those services, those needs being met, actually leading to recovery? Is it the right service? Is it the right resource? And so we developed Freedom Life Map to quickly assess, self-assess individuals in understanding what are their needs, what services would help meet those needs, and what are their strengths as well. So yes, we need collaboration with civil society, but we also need the right tools that make our work more effective and more efficient. I often heard case managers saying, I'll spend hours and hours with someone creating a case plan. And when we're reaching so few people, we need to have tools that make that work more efficient. And they're out there. We've actually developed one. And if we can scale that, we can reach more. And the research does show us that when individuals are met with the right support and with the right services, it can break cycles of exploitation in that life and then in the communities, and in that person's family. So direct services can actually be prevention as well, if done right.
No, that's great. I'm going to come back to you on another question regards the brothers. Jeff, are you there?
Let's see. Yes,
You are.
yes.
You are there in voice, and that's what that we'll take that.
Okay. Here we are. Here we are.
Jeff,
I'm here.
can you add more detail into your work and how you think about scale, who you manage to reach, and unfortunately who you can't?
Well, one of the most important things that we have come to understand about the survivor care is it's relational. It's not about whether or not you have all the skills, and certainly I'm not downplaying that. But what we've come to realize is that relationship starts with people who they feel care what happens to them. Most of them have been treated as property, and they know they're expendable. They know no one's invested in them other than the money they can make off of them. So in our model, when they come in and our nuns accept them, and yesterday I was in Stockton, California, and a survivor talked about the various number of professionals that she went through in hospitals and in clinics and therapists. But she said she went for a week just really blasting a psychiatrist, waiting to see whether or not he would react, waiting to see whether or not he cared what happened to her, or whether or not he was just punching a clock to collect a fee. And she said he became the pivotal person in her life because she became convinced that what happened to her is what she cared about, is what he cared about, and that trust bond. Many of them have the trauma bonds, and of course that's very unhealthy. But that trust bond from the caregiver is very important. And one of the things that we experienced is having a person with you 24/7, not 3 shifts coming in, a person 24/7 like our sister model works, because they're there when they go to bed, they're there when they wake up in the morning, they're there when the nighttime traumas start, and they're there, and they realize they're not going away, and they care. And that's a very, very key factor that I think we undersell. Having the right, life map, and having the right professionals, that's really, really good. And our experience with the children has become relational, where they've got to have a place where they trust that what happens to them matters to the people that they've been entrusted to. And that's been a very important part of our model. And hopefully it's something we can replicate around the world. And I realize we're reaching a very small amount of people. That's I get that. But according to the survivors that I speak with, their real healing began when there was a person that became the person they trusted to guide them. And whatever we do, I think that relational aspect of someone who truly cares about them, and to me, that's where the whole faith-based model comes in. Obviously, with many governments, that's a problem to be faith-based, but it's not about proselytizing. It's about that relational. Someone loves me and cares for me, and they're not doing a job, and they're not here for an 8-hour shift to collect a check. I think that's really key to what we do.
So I'm going to go back to
Can I
Kelsey.
jump in actually
Sure,
and just
sure you
add
can.
something to this, because I'm very much in support of that specific model. So in the National Referral Mechanism Handbook that I worked on for the OSCE, this is the exact model that we developed with top global practitioners that specifically said that adults should have an independent advocate, meaning that somebody who can take them through the whole journey, where they don't have to repeat themselves every single time, somebody that actually understands all of their needs and can be their companion through the journey from identification on to when they don't need them anymore. And the same version for guardian advocate for a child, because having trusted relationships and consistency is part of the healing journey. And that is very, very important for any service provision. And that is something that could be done both by government or civil society, depending upon the system in place. And the other part, I wanted to add that one of the things that is missing for many is proper training on victim and survivor-centered and trauma-informed approach. So every single person that is working with victims of human trafficking, whether from civil society or government, needs to have significant training in that respect if they want to be efficient and successful.
So I mean, I'll start with you, Tatiana, but I want to discuss the issue of scale, because we've all agreed that we're at a tip of the iceberg, and so whilst sort of more resources generally, obviously we can always say that there should be more resources, but when you tackle something at scale, it presents a lot more complexity and a lot more unintended consequences. So I want to get your perspective on what it will then mean to actually do this at scale. What will be required? One of the things that concerns me a bit is that when we talk about when I was in Liberty Shared and we ran the victim case management system, one of the things that concerned me a lot is that people would talk about having survivor stories, but those survivor stories would represent 1% of survivors. And so are those stories even representative of the other 99%? Now, there's a sort of assumption that they must be, but we don't really, is it true that we don't really know that? Or is there sort of sense, okay, there's enough prevalent studies out there, there's enough ethnographic studies that we're assuming that 1% does reflect what happens to the other 99. So I'd like you, Tatiana, just to respond on the idea of scale, but also on what do we know and what don't we know?
Okay, so I would like to start with the fact that we do not need survivors' stories. What we need is their lived experience and professional expertise. And this is where we're talking about survivor leaders. Because survivor stories is compelling, and compelling for fundraising, compelling, emotionally, but that doesn't actually make a difference. So whilst I was at the OSCE, I set up the International Survivors of Trafficking Advisory Council, which actually included survivor leaders from across the globe, if you include their original backgrounds. And this is where they have the expertise and professional experience to actually contribute in building systems. The other part, if you really want to do it in scale, one of the solutions that most governments are working now, whether they're functional or not, is the creation of national referral mechanisms, and I've built a number of those for countries around the world where it makes it at scale. So the things that have been spoken about here by the other panelists are actually put together on a national scale and sometimes even a transnational scale, where you have to build systems, and based on best practices, for example, that have just been provided, but on things that we know that work. And create accountability for those systems as well. So it's not enough to say now we have a national referral mechanism, but it takes 2 years for somebody to be identified and included into that system. That doesn't work. We need to have efficient and functional national referral mechanisms that actually address a lot of the issues we are discussing, from the point of detection throughout the whole cycle that each victim and survivor needs.
Can you give me an example of a national referral mechanism that you think is successful, just to give us a sense of where we would look?
I wouldn't say one specific one is successful. There are specific successful elements. For example, if you look at Scotland when it comes to children, so national referral mechanisms for children, for example. You could look at, some of the other countries. For example, Kazakhstan just launched theirs, and I've been working on it, and they're trying to create proper systems and proper training for every single region responsible. That actually makes it work as well. So, Sweden, has some good examples as well of certain practices. So this is where it is looking at pieces that work and actually addressing the gaps that don't.
Okay, thank you. Kelsey, your thoughts on scale and representation in a way of the 1% of survivors that we do know and the 99 that we obviously do not.
Yeah, I agree that the data that's missing is not about stories, right? We need to change our focus from stories to what are survivors' stated strengths, vulnerabilities, where do they want support, and then what is actually moving the needle? What is creating positive outcomes for holistic well-being? That is the data that is completely missing. So let's shift our focus on story collection and the what happened to we know what's happening, right? And things are evolving and we need to keep up with trends and how the crime is shifting, right? But then we can't stop with that collection of the lived experience. We have to move that into collection of data on what actually works and what people need. Our data, if we're talking about scale, our data does not show that survivors are prioritizing wanting support going through the justice system. They're wanting support with our top indicators globally. We're seeing our savings, income, and money management. But that's not where the majority of our resources are going when we talk about survivor recovery and reintegration. So if we think about scale, we need to first ask the question, what is going to create the most successful outcomes? What programs are effective in doing that? And that's what we need to scale. So the precursor to scale is knowing what works, and we're still lagging in that. Then once we have those solutions, we have that data, we can move upstream to understanding what were the vulnerabilities that led to exploitation in the first place so that we can meet those needs, address those vulnerabilities beforehand. And I don't think that we'll scale effectively as a movement until we begin to prioritize that.
Yeah, I'm fearful because I can see that that Jeff is sitting on a plane, so he might be leaving us literally at some point. Just before, so Jeff, do you want to just respond to this question as well about the issue of about scale and knowledge of the whole as opposed to just the part?
Yeah, am I unmuted? Yes. Uh, one of the things that I've encountered is some people who successfully survive and thrive, and now they're trying to get a one size fits all model, and I'm very weary of that. Okay, I know from our children, and we have 11 at a time, the levels of trauma, the levels of experience, the levels of trust, depending on who their trafficker was, they all vary.
Good morning,
And so I do agree very much with Kelsey that providing the resources for a person to thrive after they have escaped, and in particular financially, is very, very important, because the lack of finances creates a vulnerability that, may well put them against their will back into the same situation. But in terms of scale, I, I react to a one size fits all model, because I can look at 11 children at a time and have 11 different sets of needs. Okay. I'm gonna have to end this, and maybe, well,
No, but
maybe,
thank you.
no, maybe I can jump back on once we get airborne. So if Stuart will be aware of that, okay?
Okay.
Thank you.
Hopefully we'll
Thank
see you in a bit.
Okay.
Bye. Yeah.
May
So
I
so
add
what?
actually to this
Sure.
discussion as well? So I have conducted surveys of survivor leaders from 57 countries, actually, or survivors from 57 countries, and there's a set of priority needs that they actually have. One is the financial piece, financial stability, and that can go through a number of different ways. One is compensation and access to compensation. And there are different schemes for that, whether it is civil or criminal litigation or different government schemes, specifically or compensation funds, which would allow them to restart their lives, pay rent, etc. As well as access to employment. So a lot of times in many countries, you cannot access employment. So you're a victim of trafficking, you're living in the shelter, and you cannot access employment. And that is a major factor for many to leave assistance and support and become vulnerable to others who are looking to exploit them. The other part that is also that also creates a sense of vulnerability is insecurity in their status within the country. We were talking about whether they can remain legally or not, and for how long, etc. And the other part is their criminal records. So criminal records that they have due to their trafficking experience, or that they've been for crimes that they've been forced to commit as part of their human trafficking situation. So that actually also creates a block for them to access various resources, for example, educational grants, even rental agreements and such. So those are very, very big blocks. And for most victims and survivors of trafficking that I've spoken to, that have responded to various surveys, those have been a very serious issue.
So just to both of you and Kelsey, where does criminal justice actually sit in the work? Maybe it doesn't have a place in so much as people thought it did 10 years ago. What would lead to better criminal justice outcomes in relation to perpetrators and continued perpetration of these acts? I've heard, not just, I mean, you said it just now, but I've heard it before. I mean, why should they? Victims are not primarily interested in criminal justice outcomes. I mean, any of us who've been a victim of a crime, the first thing on your mind is not necessarily when there's been trauma, get the perpetrator. The first thing in your mind is your safety and maybe those around you. But eventually, if not quickly, you come to that issue of criminal justice. Where does that fit into this?
Definitely plays a role. I think we've slightly over-indexed on it in terms of when we're looking at the complete healing and recovery, we need to look holistically. And what we've seen through direct services and through our data is really we're all familiar with Maslow's hierarchy of needs, right? So if you don't have your basic needs met,
Mm,
you're living not just day to day, moment to moment. And so the thought of a 2 year long court case to prosecute a trafficker who that's going to be very challenging to face. You're going to have to overcome quite a lot of re-traumatization to go through that process. How can you even think about that when you maybe were trafficked to get food for your kids? And so all you're thinking about is I didn't make money for my kids. They're still hungry. They're not going to school. All you're thinking about is that yes, of course, justice is important. And when we've asked survivors in our research, what does justice look like to you? They have answers. And usually it's protecting others from receiving harm. Often it's compensation for what happened to them. So yes, justice is important, but we need to think through how do we have an individualized approach to understanding when we pursue justice and what resources we give survivors as they pursue justice. We've had a huge range in those who come through our services from not wanting to do that at all, from not wanting to focus on anything else until justice is achieved. So we need to ask first and foremost. We need to inform, we need to educate on what the rights are. Many survivors don't know what their rights are. So that's from a victim service provider, but also from a law enforcement, from the justice sector piece of things. We also know that when those services are trauma informed, when they're victim or survivor centered, you have much greater engagement.
mm,
We have a young woman who had such a positive experience with the justice sector, with the criminal investigator who led her case. That criminal investigator came to her graduation. This girl is pursuing a law degree because she wants to be a prosecutor. And that's not every case, but when we set up our systems to be survivor centered, to be trauma informed, we're going to have better outcomes, but we have to let the survivor lead the way.
So, I mean, I'm not going to go back to that, but that does bring us back to this issue of scale, is that at this level, individualization can work. Once you move into hundreds and thousands and millions, then you have a scale issue in it being individualized. And I'm assuming at this point, both of you have said that systems then need to be in place to make it work more efficiently. There's an old phrase in the nursing profession, which is if it's not documented, it's not done. And both of you are highly professional in your work. Now, a lot of other NGOs at the front lines, they are much more kitchen table based, people just passionately going out to help their community, not necessarily professionally trained or with professional experience. So a lot of information is not documented and not done, and therefore, in a sense, unknown and will forever be unknown. How are we going to get better information and better knowledge to create the things that you're describing at a global level, even amongst those people or those people that are already working on this? That seems to me a challenge for now, as opposed to thinking about scale, which comes later. So how do we actually, and I don't wish to be disrespectful, but how do we obviously make professionalize more at a higher level than we currently are doing?
Can
Tatiana, do you
I?
know?
Yes, I've had many discussions of this, and I've seen many different things happen on the ground. The truth is, when we are getting a victim of trafficking, we are getting someone with very complex needs, physical needs, psychological needs, legal needs, etc. So and it's the same thing. If you use the analogy, it's like taking, a person with significant, medical condition to a lay person who's not a doctor and then asking them to take care of them. This is an impossibility. So this is where we do a lot of harm. There needs to be proper training and proper accreditation for those that are providing services to the most vulnerable people out there. It cannot be, I decided that I'm going to run a shelter for victims of trafficking tomorrow, and then I do so. It shouldn't work like this. And this is where actually a lot of the criminal justice response is impacted as well, because those people will say, no, 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 you don't need to talk to the police. They do not understand the basics that if we do not actually create a system that is truly victim informed, that is trauma informed and such, and that works with law enforcement, we're going to continue having these cases, because it's enough to say, well, the victim does not want to talk to the police. It's about actually addressing as to why. Was the recovery and reflection period granted? Is the police trained in how to work with victims and survivors of trafficking? And once we address those things, as Kelsey has said, you're going to have a different system in place that actually can be put to scale, that can actually prosecute traffickers, that can actually stop this crime from happening, because it's happening, with complete impunity at the moment.
Kelsey, accreditation, I like it. Sounds like a good plan to me. But is that possible? Can we move towards that?
I think it's all possible. It's what we decide and commit to, right? When we're talking about scale, and you mentioned how do we move from hundreds of thousands into millions, it's a commitment, and it's a shift in our mindset, because the research shows the lifelong cost to society of a victim not getting services, even if they do get services, it's astronomical, right? It's in the hundreds of thousands up to the millions in healthcare costs, in loss of their contribution to society, and cycles. And so we need to shift our mindset, right, into how do we build systems that are effective and efficient, that can individualize care, that can get those who have experienced exploitation the right services at the right time. These things are possible. We've done them. We've had success in other areas of needs, of global needs. It's a commitment to where are we going to spend our resources? Are we actually going to allocate them effectively so that we break cycles, so that we spend maybe 2 years doing survivor services the right way instead of 20 years supporting someone part way so that they just keep falling back into the system. Our organization recently was supporting cases from Myanmar. So Ugandans who were a part of those online scams and the scam cities in Myanmar. And people were so excited to buy them flights home to Uganda. But if that's where we stop with the flight home, we would have spent resources that are likely going to be needed again, because if their needs are not met, if the traffickers aren't prosecuted, if those core vulnerabilities of economic instability aren't addressed, we hear from these individuals, they will go back because there's no other opportunities except to take a risky journey, hoping this time it will be different. So to scale effectively, we have to change our mindset.
And what are the obstacles to changing the mindset to getting the kind of commitment that you just mentioned? What's hindering us there?
I think our movement started with quite a lot of passion, and good intentions, but not an emphasis on effectiveness, not an emphasis on long-term changing systems. And so it's the institutions that can help drive this. It's including survivor voices at all levels. So institutions must say we're prioritizing this, right? Government
Hmm.
agencies, multilaterals, prioritizing it, resourcing it, identifying that it's much better to spend the resources here than on emergency services, than on homelessness in our communities, right? It's shifting our mindset at the government level. It's also shifting it at the funder level. We need funders to be asking those questions. I think it's going to be really hard to get accreditation. That would be great. That has to be more at a government level. But funders can lead this. Funders can ask those questions. Funders can resource direct service providers with tools to do the work well. They can not fund just those flights home, but say if we're going to fund the flights home, we're going to fund the full services of these individuals.
No, I think
Can I just
Tatiana?
add to
Yeah.
this? It's about professionalizing this. All other situations, those that are providing services for people with substance abuse issues, that's professionalized. Those that are providing psychological services, that's professionalized. So for people who are managing all of this, it's not professionalized. It could be anyone, really. And that is an impossibility, and this is why it does not work. Actually, I've had these conversations with many top experts in the world, for example, including Kevin Highland, and this is why, the National Referral Mechanism Handbook is very clear. This needs to be professionalized, because if you want accountability, if you want resources spent properly, if you want to actually provide to victims and survivors what they actually need, it cannot be just anyone get up from the street the next day. I want to do good. I want to help victims of trafficking. And all of a sudden they set up shop and they get victims of trafficking. It doesn't work like this. And this is where the systems are failing. Instead of investing those resources into organizations that actually are doing the work, that have the experience, that have the know-how, and that are running things professionally. And that's the big difference, I think, that I have seen between victims who have fallen into organizations that really want to do good versus organizations that know what they're doing and they're accountable for what they're doing.
No, that's very important. I completely agree with that for what it's worth. As we've got a couple of questions, and actually it takes us on to the next point anyway, which one is a question about hotlines and another question is about AI. And I'm going to combine these two questions because there is a rumor, and it is only a rumor, that there will be an RFP for the US hotline. And one of the potential ideas is that the hotline, if it does go to someone that is not Polaris, that it would be much more of an AI approach. Now, what's your response to an AI run hotline? Tatiana?
So as a first set of approach, for example, for AI to be customized to speak the language, to look like the person that is addressing it is not a bad thing, but it needs to be managed by human beings. So for example, the minute that there is a situation, not I want to ask a question about human trafficking, but I'm in this situation that needs to be transferred directly to an experienced and trained person, not a volunteer somewhere, not a student working part-time. It needs to be transferred to a real person that could connect that person immediately to whether it's law enforcement response, services, etc. It shouldn't be, just AI run. Because then it's just a bit pointless. It's data collection, not
Yeah.
a hotline.
Kelsey?
I completely agree. I think we have opportunities to make our work more efficient using AI. We all are beginning to use those tools. But AI on its own, without human guidance and human management, can turn into a monster, and especially as a hotline. I mean, how many of us get frustrated in our day-to-day frustrations if we're given an AI bot instead of a human being? How much more if you're in a dangerous situation if you're not dealing with a human being? It's quite dangerous.
Yeah, have either of you seen the TikToks of people being interviewed for job interviews by AI bots?
I
If you
have.
have, if you haven't seen anyone who's listening hasn't seen those, then you should check them out. There's a great one where the person is being interviewed by two AI bots who then start talking to each other rather than the person they're interviewing, and it's tragic, but also comedic. And I think we need to avoid that would be an horrendous mess for a victim. I want to move on to the role of faith in victim care and support. And unfortunately, Jeff has not been able to rejoin us so far. But many interesting for me is that many of the many of the individuals who have a long-term commitment to this issue at the front line, and particularly in care, are people of faith, and often they're not necessarily mentioned, particularly those who are nuns working at the front line, whose lives, in a sense, are dedicated first of all to care. They haven't sort of left one job and gone to another. They're dedicating at a very professional level to do that, and then maybe specifically to this issue. So there's a sort of real range of people that draw upon faith in a different way. I just want to get your response first of all on what you've seen and where faith plays an important role, and then perhaps secondly to think about specifically how should people who use faith as a way of being of drawing their commitment, think about it in terms of the future. Where does that play a role in the future?
I'm
Kelsey?
happy to jump
Oh,
in.
Tatiana. Yeah, go ahead.
I have seen actually faith-based organizations as the only organizations providing services, period, in many countries around the world, especially in the developing countries. And they're the backbone, actually, of service provision to victims and survivors of trafficking. And very, very key to this. One comment I would make on this is that they need to be trained as well. Just as the organizations, they also need to be trained, because it's not just about goodwill. So many of them have a lot of training and experience working with vulnerable populations, but this is a very complex situation overall, and it requires a lot of training once again. Two, part of the healing process, oftentimes for victims and survivors, and I've talked to many around the world, is actually faith as well. So many of them actually lose their faith through their trafficking experience, and they regain their resilience and healing through faith. It's not all of them, but many do. So this part is also actually really important to this particular experience. And some of the best services in the world I've seen actually were by nuns, for example, in Spain and Sevilla. Absolutely incredible, to people of different faiths, where they respected their faiths and supported them in practicing their faith, which was not, they were not Catholic, for example, Muslim. So they've provided everything they would need for Ramadan, etc., etc. So there are various examples of this.
Well, thank you, Tatiana. Kelsey?
I couldn't agree more. Yeah, it comes down to, as we've discussed, professionalism, right? Faith in healing is complex, but it can be powerful for very many. And so if we professionalize and we ground our faith in inclusive, if we ground it in being inclusive, in giving choice, in being culturally responsive as professionals, we're going to be providing really, really professional and effective care. When we do not ground it in choice and we ground it in forcing folks to participate in certain religious activities or believing in a certain thing in order to access services, which we've heard about, right? If you're not coming to Bible study, you're not going to stay in this home. We can't have that. That's not professional. But if we guide folks through asking them the questions about how their exploitation has impacted their faith and what do they need and what do they want, just as we would with other services. How has your exploitation impacted your connection to your community, your health, your mental health? If we're asking those questions to really learn and ask what someone wants, and we're connecting them with the right support that they need, we can be really effective in our healing services. And it's a matter of empowering our faith providers with the education, the training, and the tools to do that. I don't think most of our faith folks set out with bad intentions, right? They're doing this driven by good intentions, but it's a lack of education and training for many. Not all, but many.
How are we going to develop? I mean, I would like accreditation. As someone who's as a lawyer, I think accreditation and regulation, or at least some sort of body, a regulatory body, is a good thing in any profession. But how do we get to where we are now to professionalizing a lot, this sort of global community of carers and frontline people?
It's about creating standards and actually having an organization. If they want to provide direct services, frontline services to victims and survivors, they need to apply for their license. They need to have oversight in the provision of their services. They need to have appropriate training. Their staff need to have appropriate educational or professional background to provide a certain set of services. And we have done this for almost any other, industry, any other, situation, that involves human beings. So I don't see why this specific topic has become so problematic in this way. This is not that hard. In any country, whoever is responsible, for example, for the response to human trafficking, in certain countries is the Ministry of Social Welfare. In other countries, it's the Ministry of Labor, Ministry of Justice, or whatever the case is, can be the responsible body to provide that set of accreditation to know who should be providing services to victims and survivors of trafficking, where should they be referring those people, and then have the proper checks and balances, and complaints mechanisms, for example, if somebody is, not treating victims and survivors correctly. And that actually creates a robust system that is then trusted by victims and survivors.
Now, I agree with that completely. Kelsey.
Yes, and I also agree completely. And one of the challenges is that we have many of these systems in place in countries. For example, in Uganda, our shelters apply for licenses. We have random checks. We love this, right? We want this to happen. We value this accreditation. And yet, the enforcement of that is under-resourced, right? So we have a government who doesn't have all of the resources to see these unlicensed shelters popping up all over the place. They need more resources to implement the policies, the good policies that they have in place. And we also need to join hands with the folks funding this work and resourcing this work, because that's actually where much of this is being fueled. I cannot tell you how many times I've talked to individuals, donors, foundations who will tell me about a shelter in Uganda that I've never heard of. And we've worked there for 15 years. We sit on the government task force. That's alarming to us, right? We have to share those names of shelters with the government and say, does this have a license? Is it an authorized shelter? And oftentimes it's not. And so we need to join hands with our funders to say, make sure that you're asking those questions. Are you licensed? Are you accredited before you fund?
Now,
And
as someone who, sorry, go ahead.
Just to add to this, a lot of times those that are not licensed and accredited actually become further centers of further exploitation, actually, and abuse, because these victims are then used as a fundraising mechanism and then maybe sexually exploited or exploited for their labor in the process. So it actually becomes a very bad cycle. And then the victims and survivors will not trust an accredited shelter because they will see it as the continuation of their abuse. So donors are key to this.
Yeah.
No, I like this conversation a lot. As someone who did legal and compliance for many years in the financial industry, licensing, compliance, standards, good practice, ethics, all of that is fundamental because, even the best intentioned person, there's scope creep. What was acceptable, unacceptable today suddenly becomes a bit more acceptable in 2 years' time, and corners get cut. And I'm completely with that. I want to, just for the last few minutes, I want to turn to prevention. And, Preveni, we've set this up, Kevin and Highland and I, and our sort of big, if not our singular mission is to impress upon the G20 to raise more resources for this issue, particularly on the prevention aspect. And that sort of is encapsulated in our tagline, sort of 30 by 30, $30 billion per year by 2030. And hopefully we'll get somewhere close to that. If there is to be more money raised, the question is going to come, what's it to be spent on? Because, it's obviously a pipe dream just saying, oh, we'll raise more money. You've got to be saying something about what it'll be spent on. And you both of you already talked about some of those things. But to be a bit more specific now, if we're asking for more money, Kelsey, what's it to be spent on? And I understand that it's not going to be spent in the same way, in the same place. So don't hesitate to break it down a bit into geographic areas or populations or different societies.
I mean, this is a full dissertation question you're asking
Indeed.
here, Duncan, with lots of math involved. But I will say, when we think about preventing exploitation and human trafficking, we often haven't been very data driven or targeted in these prevention efforts, right? And so when we look at the various forms of exploitation, there's various prevention strategies that we need to look at, right? So if it's forced labor, there's often resources that need to be spent in regulating and then implementing those regulations in supply chains. With those resources, we can prevent quite a lot of exploitation if done well. And again, we cannot just have policies and regulations in place. There have to be resources for enforcement. Very, very important. I believe it's very under-resourced right now. If we're looking at survivor services, we've talked so much on this call about that less than 1% ever access services. And of those who do, many end up being re-exploited again and again as a lack of having the right resources. So it is prevention of trafficking to invest in getting survivors the right resources that they need at the right time. Prevention of re-exploitation and then breaking those systems and cycles that happen at the family unit and in the community. So we do need to be investing heavily in supporting survivors and in building systems that are sustainable, right? We need governments to begin taking this on. We need government resources to begin to sustain this work. It cannot be reliant solely on NGOs and civil society forever. We have to have those become sustainable like they are in many other issue areas that we have in our communities. And then when we're looking at prevention of human trafficking and we look at sex trafficking and forced marriage, we need to be spending resources on looking at demand, right? We need to be doing some cultural perceptions changes of what's acceptable, what is a crime, what is unhealthy for our society. I don't think that will make a significant impact unless we begin to address those behavior changes and those perception changes. And we need to use a data-driven approach to addressing the root causes that lead to exploitation. And those are different by region and by form of exploitation, right? So we need to understand, we know that not everyone who experiences poverty experiences human trafficking. We need data and resources to tell us what are those unique combination of factors that if we can address can prevent exploitation. And our tool is gathering this data. It sounds like, Tatiana, you have incredible data as well. When we start matching that data to resources and really building data-driven programs, we're going to see a much larger return on our investment than what we've seen so far.
Thank you, Kelsey, and thank you for joining me in this hour. Tatiana, I'll leave the last a couple of minutes to you.
Thank you. It's a very important question, but what I would like to add to what Kelsey has said is that if we really want to prevent the crime of human trafficking, because it's not a social phenomenon, we need to end impunity and we need to go after the profit. Those two top things will actually stop the crime from happening to begin with. The other part, so if traffickers are no longer making money and going to jail, they're going to stop participating in this type of crime. And that's extremely important. So we need to invest actually in the criminal justice approach that actually works so that we can prosecute more cases. We need to do thorough financial investigations and hold individuals and companies accountable for having trafficking in their supply chains or for trafficking other individuals for whatever type of trafficking. And the last part, the demand piece, is important. There are many countries who have adopted the equality model where they hold those that purchase sex acts accountable, and that has statistically demonstrated that it has decreased trafficking for sexual exploitation to those countries and demand for this type of trafficking as well. So all of those, a legal solution that can be adopted and has been adopted in many countries, and going after the money and ensuring the traffickers go to jail.
Thank you. That's certainly the going to jail and the deterrence is something that I think has got to happen a lot more than it has. I want to thank you both for joining me. Looks like, I mean, unfortunately, Jeff didn't make it back, but a safe flight to him. And thank you very much, everybody. There's another webinar at the end of the next month on the apparel industry, but I want to thank Tatiana and Kelsey for joining me.
Thank you,
Thank you so
Duncan.
much for hosting this event.
Thank you.
Thank you, Tatiana.
Bye,
Bye.
Kelsey.
Bye.